Hi, I'm Dr. Brooke Nemec. I thought I would just give you a little bit of information as to why you should consider veterinary dental specialties for your residency program. I've been board certified for almost 25 years now. I've trained a lot of people. One of the big advantages to being part of this group is we are the biggest dental group in the world. Currently, there's 13 veterinarians and 18 locations. So it's all a big family. And I think if I had to pick one word to describe this residency, it's family. I do consider, you can ask any of my residents, I consider them my kids, and I really treat them as such. So we are a family, have a group chat, and there's pretty much always someone available to answer a question. If you're not sure whether you're at home reading or if you're managing a case in one of our satellites as you get more advanced. But that's probably the biggest thing is we're a family still. And other things, because we're so big, and because Dr. Furman and I especially, we work so hard, it's unmatched caseload. I think in our practice, we are kind of up somewhere over 2,500 to 3,000 cases a year. So it's really, unmatched as far as the number of cases that you're going to see. Also the variety. We are one of the veterinary dental practices that does a lot of root canals and crowns. Most of our residents are done within a year. After their first year, their case logs are already done. With all the writing that I've done, with all of the caseload that we do, things for papers are actually really, really simple. So they're doing all those things, especially having Dr. Skinner and Dr. Furman. I mean, we have 4 diplomats in the group as well. We all have our varied interests, so it's really good educational. And like I said, I've written a ton of books, I've written a ton of papers. I'm pretty good at getting those things through. Another big reason, we have a board certified anesthesiologist on staff. Full-time, and that she's here mostly in San Diego. She goes up to the Irvine practice as well. So those are our residency sites. Not only do you do the 40 hours with her, obviously you don't have to travel for that, but just the day in, day out of learning anesthesia. But not only learning anesthesia, the beautiful thing is you don't have to think about it most of the time because we have that backstop there to take care of it. Having Dr. McNally in this practice has revolutionized us. You don't have to worry about, oh, can this dog have non-steroidal anti-inflammatories? Well, ask Aaron. Should we work this dog up further? Ask Aaron. So you have the best of both worlds. Honestly, don't count on this yet, but we're looking at hiring a radiologist too. So the benefits of being this size of a practice is that we do get to have those benefits of using the corporate style, but without being a corporate practice. All of our residents gets loops by the 6 months in, so they can do surgery with it. That's just part of the residency. And then we have all the bells and whistles, and I'll show you some stuff as we go through the operatories, the cone beam CT, the in-house diagnostics, all these things that we have in our primary residency sites are really second to none. So I'll take you around the operatory, but those are the main reasons that I think you should choose here for your residency. Another reason you want to select veterinary dental specialties, especially our San Diego flagship office, is our operatories. So we have 4 operatories here, but they're all separately contained. I'll talk about that in a minute. But basically we have custom Corian tables, easy to sterilize, okay? Stainless steel, again, easy to disinfect to keep it nice and clean for your patient. We have the latest and greatest in monitoring here. That is a multi-parameter monitoring. It monitors everything that we need to. The nice thing is this is also Wi-Fi connected to our anesthesiologist, so she can keep an eye on all of our patients, whether she's in the room, whether she's in her office or at home, to be honest. And it's really nice safety. Our anesthesia comes out from the walls. We have all sorts of patient warming devices to make sure that they're safe. Our drill machine comes out from underneath here. We have a remote compressor, so it runs all the things for the training center as well for here. So everything's kind of off the floor. It's nice and quiet in here. This is all ergonomically designed. Nice bright lights, although most of us wear loops as well. And then the final thing that I'll show you here is that our X-ray machine goes back and forth to both tables, so we share it to the one that's on the other side. But one of the nicest things about working here, as opposed to so many other practices, is when this pass-through is closed, this becomes sterile surgery. So the linoleum that we have on the floors down here, there's no corners. It's all set up beautifully so that we close all the doors. This is a HEPA filtered, so it basically, we could do sterile surgery in here if we needed to, but it also keeps, the bacteria from spreading from patient to patient. And also, if you recall, when you guys come back and see your pets under anesthesia, or you're working with a client as a resident, that you don't have another procedure going on nearby. So this is why we set this up like this, to be the ultimate in care for our patients. So another thing we have here at Veterinary Dental Specialties that not all dental practices have is a full IDEXX Diagnostic Suite. So we can run in-house CBC chemistry as well as a SediVue for urinalysis. So pretty much we can get any pre-op diagnostic we need day of, and we can check it post-operatively as well. Gives us great information to keep the patients really safe, as well as it's great for residents and, well, the diplomats as well, to make sure that we are doing the absolute safest anesthesia for these patients as well. So another piece of technology that we have here at Veterinary Dental Specialties, at least in most of our clinics, is a cone beam CAT scan. It's complementary to our dental radiology. It's not absolutely critical in my opinion, but it does add some nice information, especially when we're talking about trauma cases or oral cancer cases, because it gives us a nice 3D imaging so we can better plan surgery and also check post-operatively. So this is a dog that has a bilateral jaw fracture here. You can see when we look down on this cone beam CT that you can see how it's off in this particular area, and we can look actually within it as well and see from in here where it's fractured. So not only does that help us know how the alignment is, know what the bone looks like, it also will allow us post-operatively, if we do it, to make sure that it's aligned in 3 images as opposed to with dental radiographs being just a 2-dimensional image. Another piece of equipment that we have here at Veterinary Dental Specialties, at least in our flagship San Diego location, is full body X-rays. Pretty rare in a dental operatory because we don't use it very often as far as dentistry. What do we use this for? Well, anesthesia. We have a lot of patients that we do with cardiac disease, lung disease, and it's really nice to be able to snap a preoperative radiograph so our anesthesiologist can look at it and say, yeah, the heart hasn't changed, or the lungs look good. And postoperatively, sometimes, especially with brachiocephalics, they may not look all that great postoperatively. We're like, well, is this upper respiratory? Is this respiratory? We can snap a quick X-ray, get it off to be reviewed as well if we need to. But having our anesthesiologist in clinic so often really helps us out to make those decisions so we can take the best care of your pets and our patients.